Great, we get to go first. I'm Alyssa DeWolf. I'm the pastor at First Congregational Church of Santa Barbara, UCC. I've been here for 2 years, going on my 3rd year, and what was my other question I'm supposed to answer?
It was community look like?
What's a healthy community look like?
Yes.
I think a healthy community is where people's basic needs can be met, and where people are pushed and able to see their best selves realized by having their basic needs met.
And out of curiosity, how would you see Santa Barbara doing that right now? Well, not well, or?
Not so well.
Okay.
Yeah.
We'll get into it.
Yeah. Not so well.
I'm Father Robert Fox, go by the same name, Carambos. I am the pastor at St. Barbara's Greek Orthodox Church, and I live over on the Mesa. I've been here for 1 year, and my idea of a healthy community is one that's joyfully progressing and able to meet all of its challenges with no one left behind. Of course, taking into account the idea of health being something that is truly holistic, where you're taking into account people's soul, mind, and body as well.
Great. Thank you.
I'm Pastor Louis Watkins, Friendship Baptist Church on Cold Street. I've been here in March, it'll be 12 years. So I've seen a lot of changes, good, bad, and different. And I found that our community needs a lot of work in order to help. So my job pretty much is to ensure that they feel safe, and which is kind of difficult to do. And their trust level at Santa Barbara isn't too healthy. But otherwise, I'm enjoying working.
Thank you.
Jay Shirley, and currently the interim pastor at the Presbyterian Church in Montecito. I actually have been affiliated as a pastor at that church for the last 7 years. And it's a unique place. Being in Montecito, most of the people that I deal with are older, so they have constant health needs. And a lot of that has to do with how do you move into hospice. And so, you know, it's interesting to watch the different choices. They're often a lot financially based. As far as my take with people that have means, I see them a lot more tendency to go to concierge doctors because they can. And so just skipping the whole problem of insurance and such things. What I see with younger people that I work with and people that lower income is choosing to go with no insurance or get just like a major medical policy that kind of covers disaster. So they tend to avoid going for help when they're sick, and you see different consequences with that. So I think right now my perception of the medical community in Santa Barbara is it's in flux like the rest of the nation because of the changes, and how that settles out is, in my mind, yet to be seen. So, but you can always improve. What we can do now medically is just ridiculous. It's phenomenal what we can do,
Right.
And hold some of my people are living to be who actually get in those, take advantage of those quadruple bypasses and all that kind of stuff. But yeah, so it's a question that we'll always be asking, I think.
Yeah.
How can we improve, be inclusive, and offer insurance to the uninsured? So.
Great. Thank you.
I'm Father Brian Cox. I'm the rector at Christ the King Episcopal Church, and I've been there 25 years in the community. I also, in addition to that, I work as a diplomat with a non-governmental organization in Washington, D.C., and we work with large-scale political conflicts. So I worked in some pretty unhealthy situations like Syria and Iraq, and spent 8 years working in Kashmir and in Sudan. So I see sometimes situations that are very worse, and that a wider frame of reference than just Santa Barbara. I would say, as relates to here, that I think that, for one thing, given the nature of the community we serve, it's important for people to have their spirituality taken seriously, and that it's something that's an important part of the healing process. Secondly, I think the role that family plays and the health of family, because often people are stressed out because of broken relationships in families and everything, and it begins to affect their physical health. I think also the stress of living in Santa Barbara, the cost of living here is difficult for a lot of people. As one city councilman told Lewis and I, that this is becoming more a community of the rich and the poor who serve the rich, and the middle class is beginning to get squeezed out in this particular community. These are health issues, I believe, beyond just the physical care. And I've been calling on people at Cottage Hospital for 25 years, and I have nothing but good things to say about Cottage Hospital.
Thank you. It's interesting, the point you just made was raised in our previous group, where someone from housing made the same distinction in terms of just the class differences, where you've got some who are very, very affluent, and then you have people who serve that affluence, and they serve it whether it's in agriculture or the service industry, and those are by nature low-paying jobs, which then, coupled with rising housing costs, create this untenable situation, which we'll get into in a second. I'm going to take a break from going around the table with you and just pause for a second. I was remiss in not allowing my colleague Allison and our friends at Cottage to introduce themselves quickly. So,
I'm Allison Conwell from Gail Will, working with Bob, supporting population health on their Reduce Mentor and Population Health Initiative.
I'm Maddie Fry, Director of Population Health Evaluation. Have been here with Cottage for about 7 months now. Moved here in January, so relatively new to Santa Barbara. My role is to figure out what success would look like and if we're achieving it. So we've got this year kind of carved out for really data collection, and we consider this data collection. Listening to you all and listening to what's happening in the community, we consider that to be just as important as the scientific data collection process that we're going through right now as well. If not more important, actually. And so we're kind of marrying these two sort of sets of data, and we'll see what we come up with, and then work with our partners to figure out in what direction we should go in. So thank you for joining us today.
I'm Monica Ray, and I am in population health at Cottage Health. I have been at Cottage for a little over 5.5 years, and I work in community benefit programs, so outreach to the community and overseeing our grants programs.
great. And now back to you.
Okay. I'm Mark Childs, and I'm celebrating 25 years as well as a cantor at Congregation of the B'nai B'rith, which is the Reform Synagogue here in Santa Barbara, up on San Antonio Creek Road, neighbors of Paula and Denise. Let's see, I guess back to the question was, what does a healthy community look like to us? I guess my take on it, in addition to agreeing with what others have said, is I think about why do people join a congregation? What draws people to actually become one of many in a congregation of faith? And I think a healthy community is one where you can feel like you are part of something that will support you in celebration and celebrate with you, mourn with you and help you heal when you're in need of healing. And whether that means, knowing that people care about you, knowing that people will miss you if you're not there, is, I think, a big part of the healing process. And knowing that there's prayers said on your behalf, or that you are a part of a phone list of pastoral calls, or in our congregation, we look at our whole congregation as a caring community, and that those things aren't relegated to the pastoral care. Every member of our community is seen as responsible for every other member of our community, and reaching out in whatever ways that they can. And when that happens, I think that's a healthy community.
Thank you.
Denise Leichter, and I'm the pastor at Community of Christ Church, neighbors here. I've been in Santa Barbara as pastor for about 6 years. In addition to pastoring our congregation, I'm a registered nurse, and I oversee 26 congregations in Southern California as a senior health advocate to work with the pastors who are looking at the demographics of their congregation and the aging part of it, and the body, mind, and spirit health that we're attempting to bring for our congregants, and paying attention to some of the disparities of income that we're now seeing, especially in the Santa Barbara area. We do have the very rich, and we are having an increasing amount of very poor. And so for us as a congregation, some of the justice issues of not just access to care, but ongoing relationship with people that just need to have some sense of healing in their life, bodies, minds, and spirits, is important to us as a faith tradition. So I think for a healthy community for us, because I'm spending so much time with seniors, and more are becoming more isolated within their homes, and the greatest thing that I'm responding to on a regular basis is the fatigue of the caregivers. And we just don't have an excellent model on that yet, on how we take care of the caregivers, because then my experience has been now I have 2 unhealthy people to be dealing with on a regular basis.
And the caregivers die first.
And many times the caregivers die first, and don't feel that they can access support services for themselves, because that means they have to leave the person that they're caring for, and there's financial ramifications to it. So for me, that is one of the things that I'm trying to be more attentive to, and would love to partner with others in figuring out what this looks like for us.
Thank you.
TJ Rashears, one of the assistant pastors at Free Methodist Church, Mesa, on Cliff Drive. I've been in Santa Barbara, I guess, for a total of 5 years, but for a stint in North Carolina in between part of that. So, grew up in Santa Maria, so fairly local. I've been at the church here as a pastor for only a few months, but even in that time, one of the big things that has come up has been the caregivers. Wanting to see that as not only a population that is overlooked, but a population that's burning out, that is exhausted, in addition to the people that need the care also feeling exhausted. So it's just kind of a cycle that's feeding into itself in harmful ways. So,
Thanks.